Hello, my name is Vince Bicari. I'm going to talk to you about healthcare data and how digitizing the personal health data is changing how we manage health today. To give you a little bit of background about myself, I am currently in the MBA program at Wayne State University. I've worked in healthcare IT for over 16 years, and I am currently working for a Detroit area health insurance company. Care data, we are moving toward an era where patients are expected to take charge of their own health instead of relying on professionals. And health insurance companies are giving discounts to people that stay healthy, measuring things like BMI, blood pressure, blood sugar, and more. Smoking, for example, where if you are considered a healthy patient, you actually will pay less for your health insurance. That's putting the onus on you to take care of yourself. It's much different than it was in the past. Some of the types of healthcare data, demographics, so how old you are, where you live, and then the different claims that you submit. So when you go to a doctor for any kind of reason, that provider will submit a claim to your health insurance company, and that is a claim, and that is now part of your healthcare record for a very long time. Lab results. So whenever you have any kind of lab done, like typical blood work would be cholesterol or blood sugar, A1C, all those different types of values, all those lab results are saved and are also part of your healthcare record. Pharmacy, when you get a prescription for any kind of drug, that would be your pharmacy data. Measurements such as BMI, your waist, your height, your weight, all of those different things go into your measurements. And then fitness and nutrition. So that'd be how many steps you're taking, how well you're sleeping, what you're eating, and those types of things. So I want to talk a minute about fitness trackers and smartwatches. So these becoming very popular, and they can track measures such as how many steps you take, your heart rate, and even tell you how well you're sleeping at night. The newest Apple Watch 4 can even detect an irregular heart rhythm, which is fantastic. You don't have to go to a doctor. I mean, if it can detect things before it becomes serious, so maybe before you have a stroke, the Apple Watch might be able to detect that you had an irregular heart rhythm. And as technology develops, more and more of these options will be made available. They're currently working on automated watches that can take your blood sugar and your blood pressure just as a nonstop routine. So it would just record that constantly, and all of that is a lot of data. 1 in 5 Americans will wear a smartwatch by 2021, according to some research that was done in 2017. And now with the latest trends, you could see that the Apple Watch populator will actually increase those numbers even further. So in other words, a lot of people are going to be wearing these fitness trackers and smartwatches by 2021. And all this information that these trackers are storing are all stored on your phone and also uploaded to the manufacturer's cloud, whether that be Fitbit or Samsung or Apple. They're all tracking all of this data. And some health insurance companies are actually asking for you to sync your fitness tracker data with them and giving you something in return, like a discount on your insurance or maybe prizes if goals are met. Like let's say you average 10,000 steps for a month, maybe you get some kind of credit on your account or something along those lines. In my opinion, these types of incentives will become more and more widespread in the coming years. So what can we do with all this data? Well, what I think we should do is expand the Health Insurance Portability and Accountability Act, or HIPAA, to include digitation of the personal health record. This would allow patients to store their health record digitally in a universally understood format, and that part of it is very important, the universal format. That way, you could share this information with anybody you need to. You go to a new doctor, or you go to the ER for something. You could have your health record portable on your phone and share that with the hospital, so then they have your entire health history. That could be what you're allergic to, for example. Or maybe if you get into a car accident and the ER, you're unconscious and they don't know what you're allergic to, well, they could just scan your phone and get all that information so they don't make any kind of mistakes, and they can get the best treatment possible. Another great benefit of that would be if, when you go to a new doctor and you have to fill out that huge patient form, and here's an example of how this form that I'm sure you've had to fill out many times. That's a new patient form. And then we have the patient medical history and your family's history, if you drink and you smoke and your school levels, all the stuff that you have to fill out every time you go to a new doctor. And actually, they usually make you fill out every like year or two after you've been there for a while. So if all that could be stored in your personal health record digitally, and you could just share that with them, that would save everyone a lot of time. It would help you from having to remember, who in your family has high blood pressure, all that stuff. So what can we do again with all this data? If you had elderly parents and they agreed to share the data, make you kind of an owner of that data, so you could take them to the doctor, and when they don't remember what their patient history is, you can just share that through the digital record. You can have apps that look at your health record and detect when they think you might get sick based on your previous experience. If every year when the weather gets cold out, you end up with a cold and you go to the doctor, well, the app could tell you, hey, you got sick this time last year. Maybe you should start taking some more vitamins, or start washing your hands before you eat. You could do little tips like that to help you prevent getting sick. Another thing an app could do is lab results could be synced with your profile. So when you go to the doctor and you go for a checkup or whatever, and they run your blood work, and then typically I think what they say is, we'll call you if anything is out of the normal or out of the ordinary, and then you just sit there waiting for a call and hope it never comes. Well, imagine you getting just a notification on your phone, hey, your test results are in, and you click and you view those records. I think that's very important, and hopefully will be part of the future of healthcare. And actually, Henry Ford Health System is already in the right direction in that. They have a chart called My Chart, an app called My Chart, that when you go to a Henry Ford doctor, your results are immediately in that app. The problem with that is it's not universal. You have to go to a Henry Ford Health System doctor or hospital or urgent care for the app to work. It'd be great if they could expand that with other health systems. So we've talked a lot about what all this data means to someone personally, but what about bigger than a person? So all of us put together, all of the people that have all these trackers and all this data out there. That's all those together collectively can be called big data. So all the applications of health data at a large scale are big data and AI, artificial intelligence. Imagine if everyone's health data could be stored in one massive big data warehouse, and the solutions that AI could come up with are endless. They could discover new trends, for example, being able to predict the likelihood that someone might have a heart attack or maybe get cancer. That could lead to maybe solving some of those diseases, or at least preventing them from happening. If they see trends in demographics, like this area seems to be developing more cancer than other areas, and they could learn through AI maybe how to prevent those things from happening. So this is a great infograph that I found online at the website at the note below. It shows some great applications of big data for healthcare. So on the upper left, you have the transform. So that's you transform the data into compelling stories. So you go to the doctor and you get all this this data, and now they can make better healthcare decisions for you, helping you bridge the gap between engagement and action. Leverage the data so you move from product focused to more of a service focused healthcare environment. Data throughout the organization, so you have centralized data, meaning more people have access to it. Of course, it's controlled, so you as your owner, you own your healthcare data. You would share it with certain individuals, certain doctors, your health insurance company, your doctors, your doctor's office, and they can, with all that data, having access to it will help them make better decisions with you. And then to create the predictive health intelligence, so integrating real-time and historic health data and personalize and anticipate what you might be going through to help you stay healthy. So that's the end of the presentation. I hope you enjoyed the video. And if you'd like to learn more, there's a lot more infographics and other information on the web. So you should take a look and start thinking. Thank you.